I am Dr. Rama Subbareddy Dhani Reddy. I am the medical director of the Newborn Center at the Regional One Health and also the medical director of the Neonatal Intensive Care Unit at Labano Children's Hospital. I think there are many studies around the nation that showed regionalization of perinatal care improves neonatal outcomes. I think what it does is it provides for appropriate level of care at appropriate place for these newborns. We traditionally look at these babies and moms at 3, now 4 levels of care. By having various levels, it provides for economy of services so that we don't duplicate expensive services at many hospitals. So it provides value for us.
The Regional Perinatal Center is a great value because it provides care for high-risk mothers and babies. It also provides consultation and a referral source for physicians and other healthcare providers, and it provides education. I think the reason the program has been so successful and so well admired and supported here in Tennessee is because it's a win-win situation. It's been good for individual doctors not only to have a place to send their patients, but also to have a way to call and talk to somebody. We hear a lot about transport and referral. I don't think we hear nearly as much about the value of consultation. But sometimes I think that's a huge value to a doctor somewhere. For him to be able to call and say, this is what I see, this is what I think, this is what I'm going to do, what do you think about it? And either have somebody say, yeah, it sounds to me like you're right on it, that's exactly what I do too, or to say, well, what about looking for this, checking for this, maybe we could do this too. So it's really nice to be able to get some advice.
One of the main issues here in Western Tennessee is the infant mortality. And it is important because we here in Memphis, we have a team that can take care of all the high-risk pregnancies because this is what we do every day. And therefore, patients with high-risk issues may be transferred to us and we can take care of them. What we have seen is that the infant mortality has decreased, but what has really decreased is the neonatal mortality, because the post-neonatal mortality has been more or less the same in the Shelby County.
I firmly believe that every newborn born in our state deserves to celebrate its first birthday. And these regional perinatal centers, the 5 of them, provide extremely valuable service to improving outcomes to our mothers and our babies by maintaining an ongoing environment of improving constantly the education and training. If you look at the last few years, the progress we have made, for the first time in Shelby County, infant mortality is in single digits. First time ever. And when you look at what drove that improvement, it's predominantly reduction in neonatal mortality in African American babies. Majority of those babies are being cared for at our Regional Perinatal Center for Western Tennessee, that is Regional One Health.